Good morning. I was going to chat with you today about jaw pain. I've had a few people lately with some jaw issues, either from being at the dentist too long, where your mouth is in that open position and those muscles just get irritated, or you bite something really hard and it kind of irritates that jaw, or you clench at night. I'm Kelly with Priority Physical Therapy. I was just going to share with you some of my favorite tips to kind of watch for that jaw pain or alleviate it. Dry needling is one of my favorites because we have this big muscle right here called the masseter. We have another muscle that goes underneath that cheekbone called the temporalis. And then we have a couple others called the pterygoids, the medial and the lateral. And one of those actually attaches to the disc, which is a little C-shaped ring kind of in that jaw joint. So I was going to show you my crazy jaw because I have a lot of issues and I tend to self-treat. So if I open, can you tell which part of my jaw is not happy? Can you see one move more? Can you hear the click? So this part of my jaw is not happy. So a lot of times I don't bite well, and you can kind of see it when I talk how off my teeth are. Not a big deal, you know, the dentist knows about it, but I get some pain through here. The first place I'll tell folks to go is to Walmart and get a bite guard, because sometimes at night we tend to grip more than we think we do. If that helps with your jaw pain, go with that. It's a $5 to kind of $10 deal. If that helps significantly and you want something more sturdy, the dentist can create something, but they'll often send you to Walmart as well or Walgreens to get an off-the-shelf kind of deal. There's a self-release maneuver I like. So the pterygoids are in there, the masseter's right there. You just basically stick your finger and your thumb in there and you grip that little muscle and you just hold 2 to 3 minutes. You can do it self-release. I've done this to several folks. There's some other jaw mobilizations that we can do to kind of help pull down and forward and loosen that up. There's some needling we can do through some of these muscles that are really immediately effective, but we have to find the root cause of why your jaw. Mine is just congenital. That's the way I was born. The other thing I'll tell folks, so if the bite guard, the self-release doesn't work, you can do we call it a reciprocal inhibition. So when you open, it works the opposite muscles that make you close, and it makes those little muscles that help you to close turn off. So it's like turning on the off switch. So you're going to literally put your thumb or your hand under your chin. Your tongue is going to be on the top of your mouth. And you're going to resist that opening, maybe 60, 70, 80% of your max force, 3 to 5 seconds, and just try 5 to 10 of them. If that helps, do that throughout the day and start there. The last tip I would like to give you guys, and I'm doing it right now, is our neck and our jaw are highly communicable or communicative, whatever the word is. So when we're sitting at the computer and we're trying to see, or we're using our little bifocals and we're kind of going back and forth, can you see how that makes my jaw jut forward? And it can irritate a lot of those structures. So posture is huge with a lot of things I talk about because I feel like in our society it's the root cause a lot of the issues. So addressing kind of head-on body is really important too, because the more you're here, once again, that jaw just mechanically wants to jump forward. So alignment is key. So chin tucks, if you've seen me for my neck stuff, kind of chin tucks, either retractions or just tucks or both, can really help to keep that from getting aggravated. If you have questions, comment below. If you have a friend who has jaw pain, tag them and see if this will help them. If not, physical therapist is very capable. I love treating the jaw because it's pretty quick in calming itself down after we give it a little bit of help. Once again, we just got to find the root cause. Like, why is it getting irritated? Is it sleeping? Is it stress? Some of that we can change, some of it we can't. So comment below, tag someone you need who needs to read this or see this, and hit me up if you need me. Bye, guys.